Hello, everyone. Thank you for joining me today. I am Dr. Debbie Hamilton, and I am going to talk about support for our immune system. Um, all right, this will be recorded, so I will have the options for having people listen to it later or listen to it again. And the reason I'm doing this is obviously we're in a crazy world with a pandemic, and people aren't talking about what we can do to prevent COVID or what we can do to support ourselves. The focus is really on kind of hiding away as opposed to supporting our immune system. And I'm not going to get into all that details, but just really talk about what we can do, right? Let's be proactive here. This is integrative medicine, prevention, and proactive. So just real basic, a couple things about the immune system. So the cells in the immune system are primarily white blood cells. If you've ever seen a copy of your blood count, you'll see WBCs as one of those listings, and that's white blood cells. So all of these on this picture are white blood cells. So the cells on the left are a lot of what we call kind of the second line or adaptive immune cells, things like B cells and T cells. On the other side are a lot of our kind of first line immune cells. So an immune system, specifically for a virus, for really any kind of infection, there are two sides. There's the innate on the left, that purple circle, which is the immediate immune system. So there's no memory. So if it's a virus, if it's a bacteria, it doesn't matter which one, the immune system will act the same way every single time. And some of the most important cells in there are something called the natural killer cells. And that's something we can actually support in our bodies. And the natural killer cells are exactly what they say, right? They're first line killing that virus. The second part is what we call the adaptive immune system. And really, the innate immune system tells the adaptive system to get started. Like, hey, we have an infection, we've got something in our body, we got to get going. And this one creates what we call memory. And memory means if you get the same infection again, that this immune system already knows what to do. And this is the same idea if you get a vaccine. If you're giving a vaccine, you want the immune system to create memory, right? And so that's kind of a really important concept. Now, the adaptive immune system has kind of different parts of it. There's something called the antibody-mediated immunity, which are the B cells. Now, B cells make antibodies. And if you think about the tests we're doing for COVID, we do antibody tests to see if we've been exposed. It's interesting because the B cells make antibodies and they primarily work, their primary strength is for bacteria, not for viruses. Now, T cells, they also make smaller antibodies called transfer factors, which I will talk about, but they are also involved primarily in the viral system, right? But we don't measure T cell response. So in many ways, we do not know how long COVID immunity lasts because we're looking at the antibodies, which are going to last much shorter than T cell response. In some of the vaccine studies, they are measuring T cell response and are finding positive T cell response. So that's one of the most important things that I know in terms of probably the COVID immunity lasts longer than we think. So a virus is different than a bacteria. Bacteria can live on its own, right? Live in the bloodstream, live on its own. A virus has to have a human cell to survive. So this is really important. And there are different stages of how a virus works. So a virus has to enter a cell. It actually has to enter the nucleus, which is really the control center of a cell where the DNA and genetic material are. Then it has to basically use the DNA of the cell, of our cells, and to make more RNA, if it's an RNA virus, or DNA, if it's a DNA virus. So basically, they use our cell to make more viruses, and the viruses leave and kill the cell. And this can happen really, really quickly, which is why the best way to really treat a virus or to treat any infection is really early to get it before it's actually gone through multiple stages of this. And the different stages are different immune things like that work at different stages. So vitamin C might stop replication, and this is theoretical because there are a lot of different. So vitamin D might stop from forgetting the cell, or there's things that maybe decrease the ACE receptors for COVID specifically. So using combinations of immune products really makes sense because you're using them at different stages. And then some are antiviral and some stop inflammation. And many of our herbs have multiple functions. So using combinations makes a lot of sense. So let's talk about immune support. And I think first line, I'm going to talk a lot about supplements because that's what people want to know. Hey, what can I take? What can I do to boost my immune system, especially now? But you can't get away from diet. Like a lot of our herbs or a lot of the components of immune supplements, like those phytonutrients, are from fruits and vegetables. So what you eat matters. We don't even know all of the things that are in our foods. And eating things that are not food and adding different chemicals are just making our body work harder. So I really think that you can't get away from good nutrition and good food. And I know all of us are sitting at home, and this is not a great time to really exercise and eat well, but we got to make that a priority. So I mentioned this before, but I'm going to talk about something called transfer factors. Now, when I started medical school, which is now a long time ago, I didn't know anything about transfer factors. I knew about antibodies, but I never heard about transfer factors. So while antibodies are made from B cells, transfer factors are made from those T cells. And so those T cells and those transfer factors are really important for increasing those natural killer cells. So basically they're helping that first line immediate immunity. But they also promote a stronger Th1, so that adaptive immunity of those T cells that help specifically virus. Now they help some B cells too, the primary T cells. So I think that that's really important because if you're thinking specifically COVID, and a lot of these immune things or supplements are for every type of infection, but obviously a lot of people want to know, hey, what can I do with the COVID right now? And so transfer factors are really important because they are targeting both the first line and the second line immune system that helps with viral infections. So there's only one specific product I'm going to talk about. I gave another immune lecture for patients and spoke about more products, but this one specifically, because I've never seen anything like it, and it's a combination of a lot of different immune support in basically one product. So it's called transfer factor multi-immune, and there's also research on it. So it has transfer factors, but it has some other things that I'm going to talk about. But in research, it increases natural killer cell function. So it's helping the first line innate immunity, increases the number of both T and B cells. So it's helping your second line adaptive immunity. Plus it helps modulate because it has so many different components. So one of the things it has is zinc, about 15 milligrams. And if you're one of my patients today, you probably, you bring your children to me, you probably heard about zinc. Zinc, along with magnesium, are the most common mineral deficiencies in kids and probably adults also. So zinc has a lot of important functions. It's involved in many, many enzyme reactions in the body. It's primarily in animal products, specifically red meat. So a lot of people do not eat that. And as I said, it's hard to absorb. And sometimes people have too much copper, which is going to lower your zinc. So specifically for coronavirus, it decreases replication. That's the part of the viral cycle that it hurts. But it also is really important for a lot of immune function. And the thing about zinc is it needs to get to the white blood cells. So there are certain things like something called quercetin that helps it get into the cells. Now there's been a lot of controversy about a medicine called hydroxychloroquine, which is also called Plaquenil, and it's used for rheumatoid arthritis and for autoimmune disease. So what it does is it helps zinc get into the cells. So probably you need it before or early to help zinc get in cells, and later on the infection, it probably is not going to be very helpful, which might be why the research is mixed. But it's called like a zinc ionophore. So both that medicine and quercetin are zinc ionophores. I recommend 15 to 30 milligrams based on diet and age. So a young child might have 15. It also depends on levels. I check levels in children, and often the levels are very low, especially in my children with autism. So I will dose those higher. Zinc is also, I learned in kind of my developmental pediatric world, no zinc, no think. So it's really important for a lot of cognitive processing functions. It's important for mood. You know, the kids who go from 0 to 60 in terms of what I call rage behavior are often zinc deficient. Important for skin. It's also one of the things that tends to be low and really important for fertility. Again, not my area, but just kind of important for people to know. Bone health, vision. Zinc also, you can't, if you don't have adequate vitamin A, you can't use your zinc. So that's kind of where the vision issues come, because vitamin A deficiency leads to vision issues. So immune mushrooms, you know, mushrooms, they are fungus. So there are definitely people who are worried about that. There are probably certain people who shouldn't take them. The multimmune does have shiitake and maitake in it. They're all anti-inflammatory. A lot of them are something called adaptogens. And adaptogens is really, it helps modulate our stress response so you don't get burnt out. So there really are good modulating factors for our immune system and for kind of our mental state and our cortisol. So really supportive things. Reishi is sometimes used for cancer. Cordyceps is very good for anti-inflammatory. It also is antiviral, certain forms actually help or actually anti-infective, antimicrobial. And microbes are like bacterial and virus. So if something's antimicrobial, it means it can kill a lot of different things. It might be able to kill yeast and bacteria and viruses and parasites, right? So kind of broad spectrum. So good things to have. So astragalus, if you've ever been in my clinic, this is something that I talk about. It is an herb. It's a really good, what I call first line, boosts the immune system. And there are definitely some herbs that boost the immune system, which are important before or early on in kind of when if you're infected. Sometimes later on an infection, there's certain types where you, and I'll explain this with inflammation, specifically with COVID, that you really don't want to, you know, push that immune system too much. It also has some lowering cortisol, neuroprotection. I said a very good strong herb. It is in the multi-immune also. As I said, like only talking about one product specifically, but that's one of them just because it's what I take. I have all my friends and family take it. So elderberry is kind of classically known, and the research for elderberry is on influenza specifically. So think about that elderberry syrup that people talk about. I had a grandmother who made elderberry jam, which is kind of before her time, but very good kind of antiviral. Do not know if it works with COVID, but it does kind of push the immune system. So probably is helpful. And I guess something that's kind of easy for people to get. There's also something called andrographis, another herb. Again, kind of like astragalus, elderberry, driving that acute immune response. So good prevention and good kind of early immune support. So good boosts the immune system, antiviral, cold and flu relief. So again, something good to kind of have. And again, I think it's important to have combinations of things for your immune, right? There's different vitamins and minerals you need, different herbal combinations. I'll talk about some anti-inflammatory herbs. So again, it's also maintaining all your health, kind of improving your health and improving your immune system. So quercetin, there's a lot of people who are talking about quercetin specifically in terms of COVID. Now quercetin is what I call a phytonutrient, which means it's a special compound in fruits and vegetables that has health benefits. And there are probably a lot more of these phytonutrients than we know about. And that's why eating so many fruits and vegetables really makes a difference in our health. So quercetin is something called a flavonoid, which is actually a group of polyphenols. Some people hear about polyphenols. A lot of our like deep red, deep purple things like resveratrol and cranberry. So I've always used quercetin primarily as kind of like an anti-allergy asthma. It's a really good lung support because one of the things it does is it inhibits something called a mast cell. Mast cells are part of our immune system. They're white blood cells. They release histamine. Histamine is that chemical that causes you to itch, to have wheezing, to have problems breathing. So if you have allergies or asthma, sometimes you take an antihistamine. So things like Benadryl are antihistamines. So in many ways, quercetin is a natural antihistamine. And so that's what I've used it for. And it works, it's synergistic with vitamin C. And if things are synergistic, it means that I can use this and it helps me this much. And then I can use this one, it helps me this much. But if I use them together, it's even stronger together. It also specifically decreases the replication of coronavirus. Anti-inflammatory. Most of our herbs are anti-inflammatory, right? They decrease inflammation, and that's one of the primary works. A lot of them are also antioxidants. Things like vitamin C kind of reacts the same way, but a lot of their mechanism is because they are anti-inflammatory and antioxidant. I mentioned that you need to take quercetin with zinc. It helps zinc get into the cells. Doses 250, 500 milligrams a day. Sometimes I do 1,000 milligrams all at once. Again, this has always been something I've used with asthma and also with vitamin C. With a lot of different herbs, sometimes the form matters, like which supplement you take matters. So because what they do, quercetin, if you take it alone, isn't that well absorbed. So maybe you take 500 milligrams, but your body only gets 100. So what they've done with some supplements is they basically kind of change the form, or they put a liposome around it in order for the body to absorb more of it. And that can influence your dose. So maybe then if you take 500 milligrams, maybe you get 200, 300 milligrams. And that can influence your dose depending on the form you take. So I think it is really important to think about that, and to kind of, certain ones are fine. I mean, if you get vitamin D, it's vitamin D, and you're gonna absorb the same amount. But I said the herbs and stuff for the, water soluble, fat soluble, stuff like that makes a big difference in terms of absorption. So vitamin C benefits. I think vitamin C is underrated. People know about it. I think people don't dose it high enough. I think we need a lot more of it. I do something called an organic acid test, which is essentially a metabolism test. And I see a lot of kids who are low in vitamin C. And you need as much as your body needs. So if you have an infection, your body needs more. If you have daily stress, like we all do, you need more. So it's important for leukocyte function. Leukocyte is another word for white blood cell. Obviously, powerful antioxidant. It has antiviral. It helps with collagen synthesis. Think of people who, if you get scurvy, your vitamin C deficiency, you get a breakdown of your tissues. You get problems with your gum because of collagen. It's also really important to absorb iron. It doesn't change the iron levels in the body, but if you take it with iron, you absorb more of that iron than you would otherwise. So the interesting thing about vitamin C is we are one of the only mammals that does not make our own vitamin C, which means we have to get it from outside. And most mammals who make their own vitamin C make 6 to 8 grams a day. And our recommended dose is like 60 milligrams. So they make 6,000 milligrams and we take 60 milligrams. So we really need a lot more in terms of and I have parents who say, oh, they eat oranges, they eat fruit. I'm like, your vitamin C is low, they need more. And there are some studies now with the COVID that have looked at 3 grams or more a day helping with COVID. And they've actually done studies like that in the hospital. So vitamin D, I think that's been talked about a lot. I like to say that Dr. Fauci says he takes vitamin C and vitamin D. So really not that outside the mainstream. And the research is there. Vitamin D, there's studies that show if you have a low level of vitamin D, you have an increased risk of flu. That's known for a long time. I've seen some pretty significant studies with COVID and low vitamin D, and something called ARDS. ARDS is acute respiratory distress syndrome. That's end-stage lung disease from flu or from COVID. It's really, that's when you're on a vent, and getting off the vent and surviving that is very low. The chances are low. So you really do not want to get to that point. So vitamin D is a very much of a modulator. So modulating means it helps balance the innate and adaptive immune system. It also decreases inflammatory markers called cytokines. And cytokines are messengers that tells from release from one cell, sent to another cell to tell it what to do. But some of them will cause more inflammation and some of them cause less. Early in an infection, you want that immune system to work and you want that inflammation, because a lot of that actually helps decrease infection. And I'll talk a little bit more about that because that is a really important concept, especially with the COVID. So deficiency of vitamin D is technically defined below the level of 30. If you have a level of 33, that doesn't mean you're okay. That's kind of a low end. I have a lot of kids who spend way too much time inside playing video games and have levels in the teens. You'll also get really depressed with low vitamin D. You get more allergies, more blood sugar issues, more mood issues. So vitamin D really critical. The ideal level in my mind is 50 to 80. There are practitioners who put it even higher, but that's kind of a good, safe baseline. Vitamin D is fat soluble. People often worry, oh, can I get too much? We're talking levels over 150 or 200. And I've only seen one person who got there accidentally, who thought they were taking 2,000 a day and were taking 20,000 a day or more. It might even have been 200,000 a day. Very excessive amounts accidentally. And they were the only person, an adult, that I've ever seen be too high. And they were able to take it down and reverse it. So vitamin A is also really important for the immune system. And I'm not talking about beta carotene. So I'm not talking eating like pounds and pounds of carrots, which have beta carotene. The body needs to take that beta carotene and convert it to something called retinol or retinoic acid. And that's our active fat soluble vitamin A. And your body can't convert so much of that. You need adequate zinc to absorb vitamin A. Dose 2,500 IUs, more for acute illness. And again, antiviral, very important for our immune system. And there's been studies in places with measles, and vitamin A deficiency is much more common. And they've had worse measles outbreaks, and people do worse with measles in different countries when the vitamin A deficient. So there's a measles outbreak. Often, they go around and they give every child 100,000 IUs of vitamin A, like a one dose. So something I recommend before vaccines also. So melatonin, many of us know that we need melatonin. It helps regulate our sleep, helps regulate our circadian rhythms, but it also is anti-inflammatory. It also promotes that Th1, that adaptive immune response, those T cells. It's also decreased by EMFs. So we obviously have a lot more EMFs and stronger EMFs, and that's actually influencing our melatonin and our ability to sleep. So melatonin is higher in young children, and it decreases as you get older. So is that one of the reasons that children have less issues with COVID, because their melatonins are higher? I don't think it's all of it, but I think that might be a factor for some people. So glutathione. Not everybody knows about glutathione, but glutathione is what I call the master antioxidant. So it reduces free radicals, which is what antioxidants do. So people talk about antioxidants. So what does that mean? So metabolism, or from chemicals in our body, we get free radicals. Free radicals are just an electrical charge that's not stable. And since it's not stable, it will go and attack tissues, cause damage to tissues in order to try to stabilize itself. So antioxidants have two forms. They have a more of an active form and an inactive form, which is called reduced. So things like glutathione, vitamin C, vitamin E, alpha lipoic acid. What they do is they get rid of that free charge, so then the tissue can't be damaged, and that's an antioxidant. I said most of our fruits and vegetables are antioxidants. So glutathione, because it's the master antioxidant, and it's so critical for detoxifying chemicals in the body, there's a lot of it in the liver. It also protects the mitochondria, which is the powerhouse of the cell. It's anti-inflammatory, and it helps immune function. Specifically, it increases something called natural killer cells, first-line immunity. So I think that we need to think about that. As you get older, your glutathione goes down. If you are a smoker, if you are a drinker, if you are stressing your liver with a lot of chemicals, if you have chronic disease, and then a certain genetics, you'll have lower glutathione. So really safe thing, especially now in terms of immune function. It is something that also is really important and really high doses in the lungs. So, and this I always knew it for the liver, but I've really started to understand much more its role in lungs. And this is basically looking at a different kind of infection. But if you have higher glutathione, it's like your lungs have better antioxidant protection. It protects the damage that an infection can cause in your lungs. So again, if you have lower glutathione, you have higher risk of that ARDS or that end-stage lung disease that you have with COVID, that you can have with flu, that you can have with a lot of different infections. So there's also something called N-acetylcysteine. And if you ever hear about it, people will talk about they'll call it NAC, which is short for N-acetylcysteine. So glutathione is made up of 3 different amino acids. And one of those is called cysteine, really important amino acid in our body. It's a sulfur amino acid, you know, that kind of rotten egg sulfury smell, but really important for a lot of different reactions in our body, a lot of different functions. So N-acetylcysteine itself, in some people, can basically help form glutathione. And also is really important for lung health. Specifically, it decreases mucus. So it's what's called mucolytic. There's actually a prescription form of N-acetylcysteine called Mucomyst, and it's given for Tylenol overdose. And Tylenol basically depletes your glutathione. So please don't take Tylenol. I know it's recommended for a lot of things, and that's a different discussion. But so it's actually given for Tylenol. It's antimicrobial. It actually helps break down something called biofilms. And biofilms are basically colonies of infection, and they make this protective coating to survive. And N-acetylcysteine as a mucolytic can help break that slimy kind of form together. Anti-inflammatory, and even they've looked at it, it helps OCD, it helps some mood issues in some people, but not everyone. There's a genetic component of that. So 70 to 80% of your immune system is in the digestive tract. Think about it, first line immunity, and all those probiotic good bacteria that we have, they have a lot of different functions. And we have antibiotics in our diet, and we have things like glyphosate, which is a pesticide. Glyphosate actually kills our good bacteria, increases Clostridium for growing. So really important to supplement and to consider gut health when you consider immune health. I mean, these bacteria, these good bacteria, they actually make their own antimicrobials. It's like they make their own kind of chemicals. They crowd out the bad bacteria and the yeast. They make vitamins. They really help regulate the system, right? We have this whole ecosystem, and we need to support that. And a lot of white blood cells also. So the different types of probiotics, the traditional ones, you can call them dairy-based, food-based, live, or lactobacillus and bifidobacterium. There's also soil-based or spore-based. And these are, and if you ever see the word bacillus in a supplement of probiotics, that's a spore-based probiotic. And a spore really means this, this bacteria has a spore, it has like this hard outer coat that if it's in the soil, right, that protects it from heat and dryness and things like that. So when you take these bacteria, they go into your intestine, they lose the spore, and then they become just like some of the other kind of probiotics. I use multiple different types of probiotics. I think we're only starting to learn how many different species they are. So really, this is what we know. So this is what we do. We do kind of combinations here. The probiotics are important. So I'm going to talk about inflammation. People always hear about, oh, inflammation's bad. But there are different kinds of inflammation. If you have an infection, your immune system is activated and it makes some things like cytokines. It creates acute inflammation. But that is what fights the infection. So acute inflammation, when you need it, is really important. What the body is supposed to do is fight that infection and then signal to it that the infection's over, inflammation needs to be resolved and healed. So that's a normal acute inflammation cycle. That's important, right? You hit your knee, your immune system gets swollen, your knee gets swollen, it gets warm, and then your body heals it and it resolves. The problem is with chronic infections or chronic diseases is that the immune system's turned on and it's never turned off. So then you get all these inflammatory markers, you get all these different mediators, and then they literally cause tissue damage. And any chronic disease has some level of chronic inflammation. So diabetes, high blood pressure, obesity actually is an inflammatory state, which is why it's an increased risk. So if you have underlying inflammation from a chronic disease and you get sick or you get infection, say with COVID, then you already have a level of inflammation, which means when your immune system kicks in, you're going to have too much inflammation. And that's where a lot of people get complications. So if you have any underlying disease with underlying inflammation, that's what people who have the worst prognosis. So if you have underlying inflammation before you get sick, you want to take that inflammation down to lower your risk of different infections. And I hope that makes sense because that's a really, really important point. And, you know, and children in general have less chronic disease, although I see kids with chronic disease. So if I have a child who is obese and young, they're going to have chronic inflammation. They have fatty liver, you got chronic inflammation. You know, I have a lot of kids with chronic Lyme or chronic mold exposure. They have elevated inflammation. They might be at higher risk for some of these chronic infections. So again, think of inflammation, chronic inflammation as your immune system in overdrive, but that's going to increase your risk when your immune system has to acutely fight an infection. So then there are natural anti-inflammatories, and there's a lot of them. And we know somehow, well, how they work. A lot of these are antioxidants also, but combinations of these are really important, just like different kinds of fruits and vegetable combinations. There's something called molecular hydrogen, which is anti-inflammatory. Some things I've talked about, like glutathione and quercetin and acetylcysteine, those are all anti-inflammatory. Things like a lot of people heard about curcumin, that's turmeric, right? That's a spice turmeric that people use. Tea has this compound called EGCG, which is anti-inflammatory. Resveratrol, right? That's the red, that's the red wine. Those are the grapes. Boswellia is frankincense. White willow bark is an herb, and that's where aspirin is derived from. Omega-3 fatty acids, one of my, everybody should have omega-3 fatty acids. Probiotics are anti-inflammatory. Everybody should have probiotics in my gut book. And then quercetin, right? Quercetin and luteolin, which are both flavonoids. So I'm going to talk specifically just kind of combinations of things, and then talk a little bit about vaccines. After that, at the end, if you have any questions, please put them in the chat. So prevention, and this is what I take. This is what I have my parents on and my friends and family. I do take the transfer factor multi-immune 3 capsules a day. I said I haven't found, it's a great combination. It gets so many different things. And I said that's, as I said, I haven't found any other combination that really makes as much of a difference. Natural anti-inflammatories, and again, that depends on your health, right? How many you take. If you got chronic knee pain, you got chronic something that helps with pain also. Liposomal vitamin C, there's different forms of vitamin C. Just like there's different forms, your body can only absorb so much vitamin C, about 500 milligrams. A liposomal, just like the glutathione, there's liposomal glutathione also. So what they do is to increase absorption is they surround it with fat or a lipid, right? So I think about it as this ball with a vitamin C in it. And then your body basically doesn't break it down in the stomach and it's absorbed in the body. So liposomal vitamin C makes a difference. Liposomal glutathione makes a huge difference because that's a very unstable molecule. Vitamin D depends on your level. A really safe level in the winter is probably 5,000 IUs for most people. Vitamin A, 2,500 IUs. A multivitamin, I think a multivitamin is a basic. Zinc, a lot of multivitamins, if you have a good multivitamin, has about 15 milligrams of zinc. Quercetin, probiotics, and omega-3 fatty acids. I'm personally a favor of cod liver oil, mainly because it has vitamin E and D in it in natural ratios, and it has a natural ratio of the two omega-3 fats, DHA and EPA. So early immune support. This to me is, I've got my throat's a little scratchy. My nose is a little stuffed up. Am I getting a cold? Am I getting sick? Well, I'm not sure. Or maybe I think, maybe like the first day. This is the time to hit your immune system really hard before all those viral particles have replicated and replicated and replicated and gone through your body. So then I take the Multi-Immune, 3 capsules up to 3 times a day. Options are to take a combination of things like astragalus, andrographis, elderberry. I do add elderberry if it's influenza just because of the research. Anti-inflammatories. You're up in your vitamin C, you're up in your glutathione, up in your D. A lot of times, like the first day of a cold, maybe the first 2 days, I'll take 50,000 IUs for 1 to 2 days. And I know we're switching, they're starting to switch the doses. So you're thinking more like 500 to 1,000 milligrams or whatever I said there's a new, they're using kind of a different, instead of milligrams, the IUs are switching to like milligrams. Vitamin A, 5,000 IUs. Multivitamin, zinc, 30 milligrams. Quercetin, 1,000 milligrams, maybe twice a day. If you have allergies, if you have asthma, more quercetin, more to vitamin C, because when your immune system gets activated, that's going to activate also the mast cells. So you're going to have more allergy symptoms when you're sick. Probiotics, omega-3s, then some antiviral herbs, and a lot of the antiviral herbs are also antimicrobial. So some things like Houtunia and Cytocuta have actually been studied for COVID. But let's go to like our monolaurin or olive leaf, oregano, garlic, and different combinations. And there's some good combinations of some of these too. And then melatonin. So late immune support. So this is when your body, and specifically in COVID, it seems like COVID is the most I've ever seen this shift. And if you notice, a lot of people get COVID, they go in the hospital day 8, right? Their body's fighting infection, and if their body is not fighting the infection correctly, then they can go into that inflammatory cytokine storm. They're going to acute inflammation. So at that point, you don't want to take things that will drive that acute immune system anymore because you're increase inflammation. So at this point, you stop the Multi-Immune, you stop the elderberry, you stop the astragalus, you stop the andrographis. And you concentrate on, I need to repair my body. I need to take the inflammation down. I need to take, and the oxidative stress is going to cause, I need to basically, you're in repair mode. So natural anti-inflammatories, once, twice a day, lots of curcumin, resveratrol, everything I mentioned, high quercetin, vitamin C, almost to what you can tolerate, vitamin D, vitamin A, glutathione. They've actually looked at glutathione specifically in COVID and done like 500 to 1,000 milligrams a day, well, up to 3 times a day. With some good studies, and that's been published in the research. MICP is a combination of some of the different herbs that are right below it. Melatonin, omega-3 fats. And again, if you're acutely sick, you're probably not doing your omega-3 fats, and probably that there's certain things that if you have to prioritize when you're sick, you're doing the anti-inflammatories, you're doing the antioxidants, you're doing the glutathione. So I want to talk a little bit about vaccine support because that's a huge issue. And the way that I think about it is you want your immune system to work, to have an immune reaction. You don't want to push it too much. So I'm a little hesitant about some of the immune boosters because I'm worried that sometimes if people have a reaction, it's because their immune system, they've already had the virus or the immune system's pushed too much. You want it pushed enough, but not too much. But you also know there's a lot of different preservatives and things in vaccines that make it work. But these are things that you won't be able to process in your body. So glutathione is a major liver detoxer. So I think everyone should take glutathione before vaccines. 5 days is a set. If you're in prevention mode, you're probably already taking it. Vitamin C, vitamin A, vitamin D, and zinc, some of the base things. One of the big risks with COVID vaccine is allergies. People hear about allergies. So if you have anaphylaxis, then my bet, I would, I probably wouldn't get it at this point until but it probably depends. We just don't know enough. But if you have, say you have allergies, a little asthma, a little hay fever, you can do natural antihistamines before the vaccine. I talked about quercetin and extra vitamin C as really good natural antihistamines. For some people, I think taking a Benadryl or a Claritin makes a lot of sense. And just prophylactically, it might be really, really safe. And I told my parents to do that, and they're getting their vaccine today. I think additional liver and kidney support, there are things like from Bacana that are basically homeopathics, but really drainage detox formulas. There's also additional liver support, dandelion, NAC, NAC, stinging nettle, things like that. So then after the vaccine, you want to be able to detox any of the preservatives. So again, thinking about glutathione, probably twice a day, maybe at least the first day or two. Again, vitamin C, A, and D, and zinc, depending on your health, liver and kidney support. And then I think of doing some kind of detoxification. There are some things that people know like binders, like charcoal and clay. There's also some formulas, Toxin-Pol, NDF, which is a liquid. There's a homeopathic called Vaxaway that I've used for years. Some people use something called Thuya, which is a homeopathic also. But I think some kind of detox afterwards makes sense. Just topical arnica is also helpful, and ice for the site of injection. So the COVID vaccine, there's multiple different types that are in the pipeline. Right now we have something called mRNA vaccines. If you remember the whole viral cycle, and this is an RNA vaccine, this is an RNA virus, so it's an RNA vaccine. So basically what they're doing is they're taking, the mRNA will code for all the different parts of the virus. So they're taking a small part of the RNA, not the entire RNA. So we're not giving the entire virus, it's not part of the virus, it's not the entire viral particles, it's just towards one spike protein. And basically the idea is to replicate that spike protein and then have the body create a reaction to it. It is a different type of vaccine technology. It has been used for immunotherapy in cancer, but it has not been used. So either, if it does work, it'll probably be the safest type of vaccine, but we don't know we don't know long-term what it's gonna do. I think with the vaccine, as I said, my parents are getting it today. They're both 80 and they both have high risk factors. I think there's a short-term benefit and a long-term benefit. We're not going to know for years, so I'm really cautious in kids. There's been some kind of, theories about infertility and things like that. So if you're older, if you're really, really high risk, then I think, kind of think about it. There's no research in children. Some of the reactions are to an antibody to something called PEG, which is polyethylene glycol. So if you've had a reaction to that, or if you've been exposed to it a lot, think about, it's actually an ingredient in Miralax, which is used a lot in kids for constipation. I also wonder if we don't really know if a lot of people have exposure, have antibodies that we don't know about. So are those people having a worse reaction because their body's already had the infection? I do also think that we are in the middle of a public health emergency. So I think this is really different than maintenance vaccinations. You know, we don't have a polio outbreak, so we don't give in a 2-month-old. We might want to wait till their immune system is a little stronger. And again, such a hard topic, but I do think this is different. And I don't think we're going to get out of this whole pandemic unless we really do something. And my parents, I want them to be able to go outside. They've been inside, not seen another person in a year. And for their quality of life, it makes sense. Does it make sense for my children? Probably not. We don't know that. I would be scared for them. So brief summary. I do also want to say that this is dedicated to, I lost a friend and college classmate to COVID in the beginning of April when we didn't know as much, and also to everyone else who's lost their friends and family. I also had my brother who had severe COVID and ended up in the ICU for 2 weeks. And I'm very grateful for him to be alive. I feel very, very blessed in that way. So I'm going to take this open to questions.